and we are doing good. We are doing good here. At times we get late, at times we do things, and we understand working and coming online is another thing. So still working, man, and thanks everyone for everyone who is coming in, everyone who is bringing this channel up to grow. All your compliments are welcome. Let me clean this. Let me clean the camera here. All your compliments or everything that you say to me to upgrade to do this. So thank you so much for what you do. So I have a shiny face, my friends. So everyone, welcome to the platform. Where are you chilling from? If you are from Kenya, I'm just in today, and we have been doing some things. Over the weekend, I was somewhere else, and it could be hard for me to come online, but at least today we are here. And we want to do some 1, 2, 3 things. You remember what we were doing? Pregnancy was our topic and the complications. But there is a particular complication that we did that is called bleeding in pregnancy. And we divided bleeding in pregnancy into early bleeding in pregnancy and late bleeding in pregnancy. And the two divisions of bleeding in pregnancy, as we divided them into early and late, we said 20 weeks, that is the first trimester, maybe plus 1 month or 2 weeks. That one is early bleeding in pregnancy, and you will find that the causes of early bleeding in pregnancy mostly are different from the causes of late bleeding in pregnancy. So today we are continuing. Last time we did something else of early bleeding in pregnancy, and today we are doing something else again. We want to do miscarriages in pregnancy, because it is most of miscarriages happen below 20 weeks in pregnancy. So let's get and see what are the causes of miscarriages. Miscarriages. And as we go on, there are some words that are flagged from YouTube. I will not use them so that we understand, but we don't kill the channel. So if you are coming in right now, you are a new person to the channel, I would like you to tell us where you're watching from. I would like you to come into the chat and tell us that you are watching from this and this continent, and you are new, or maybe in the channel you are new to the channel. I would like to embrace no real lover P34 says hi. Welcome no real lover. Is it your first time here? If it's your first time to this channel, please tell us and which part of the country or the continent you are watching from, and which part of the world you're watching from. Don't fail to come in and like the chat. Jamaican uncle said hi, she is here. Like as you come in, like, so that we may get more impression, so that many people can know what we are doing. So today we are doing, how are you? I'm fine, Noville lover. I'm fine, P34A. I'm very fine. Which country are you from, Nori lover P34? Let's get to know each other. Which country are you from? And like the stream, so that we can get more of your impressions. I can see Jamaican uncles here. If you are new, don't fail to subscribe to the channel. We will talk about serious issues. Oh, I am from Bosnia. Okay, nice, Noril from Bosnia. Like the stream, and also you do what? You subscribe to the channel. I can see Ahmed is here. Peace be upon you. Peace be upon you too, Ahmed. Peace be upon you too, Ahmed. We have done several things. We are going with health of our mothers. This is a week of health of our mothers. We love our mothers, and when they are bringing life to this to the world, we want to take good care of them, and the danger signs that may come up, so that we don't get good health of the mother, of the baby, we want to be sensitizing people about them. So everyone, welcome. I can see Marcia Thompson in the house. Marcia Thompson, welcome. Everyone who is new to the house, please tell us where you're watching from. Come to the chat, tell us where you're watching from. Let us know you, and give us your likes. There's, people fear to chat in the new channel that they get in. Don't be afraid. Just tell us where you're coming from and ask us what we do, and let's continue to sensitize everyone about mental health and health matters. So we are talking about these issues. We talked about ectopic pregnancy. It is another complication that happens a lot to our mothers that are upcoming mothers. Today we are talking about miscarriages. Remember, we talked about hypertension in pregnancy. Marcia Thompson saying, I'm watching from Jamaica, the land we love. Big up, Marcia Thompson. Thanks for being here, tuning into this platform. We thank you so much. Jamaican uncle, as usual. Big man yourself. Big up yourself every time. Big up yourself every time. All your respect is granted. And Ahmed, also a new friend. Ahmed, thank you for being here always, and always liking and commenting. And everyone who is watching, you should check what Jamaican uncle do, and also Ahmed has a channel, and it's good. It's a good channel, my friends. It's a good channel. If you check it out, you will like what Ahmed is doing. So let's continue giving the likes. Let's continue to subscribe to the channel. Let's continue to support the people that are in the chat who has channels, because it gives them motivation to continue to do good things and grow. So I am young boy. My content is only entertainment. Yes, people like entertainment. When you are boring, you are bored somewhere, you comes to your channel and checks what you're doing. They feel good. So today we are doing early bleeding in pregnancy, specifically something that is called miscarriages. And miscarriages is a spontaneous loss of pregnancy before viability, mostly below 20 weeks of fetal, and sometimes you will find the fetus, most of the time their weight is below 500 grams. It is below 500 grams. You are just good. You are just there doing your things. You are just doing good things. You are just relaxing, and then you start bleeding. You see, that one is called early bleeding in pregnancy. And the miscarriages are specific types. There are different types of specific types. I will avoid that word. Your topic is about adult. Yes, about adult. It's about bleeding in pregnancy. It's very important for people to know about it. I'm only support you. You are a good doctor. Blessings. Ahmed, thanks a lot. And you are a good man. You are a good one, Ahmed. You are a good one. Continue having that same spirit. Now, there's something that is very important you should note. I am avoiding the word abortion because it is flagged. If you do it several times on YouTube, it brings a problem. So there is that thing. So if I say miscarriage, just know I'm saying the other word. Yes, I'm saying the other word. So there are types of these miscarriages, and I will name them before we start continue. Threatened miscarriage, inevitable miscarriage, incomplete miscarriage, complete miscarriage, missed miscarriage, septic miscarriage. Those ones are the ones that we will discuss. And also we will, at the end of the topic, we will discuss something that is called induced one. Someone just decided, no, this one cannot continue, I'm inducing. We will discuss even that. Today is a day we are talking about bleeding in pregnancy, and specifically we are talking about miscarriages. So let's talk about something that is important. Threatened. What is threatened miscarriage? Threatened. Your information is help to other people. Blessings, happy and healthy. Thank you, Hamed. Thank you for your touch and for your compliments. Now, threatened. When something is threatening you, what does it mean? It means that if you don't take care, you will get a problem, or it will become a problem. That's why it is called threatened miscarriage. And let's talk about it in a bigger way as we continue. What about threatened miscarriage? Let's talk about what is this. Blessings, everyone. Share Travels is here. Big up Share Travels. I can see you are here. I can see you are here. Today I'm a bit late, but blessings to you too. I hope you are doing good. Every time I see you, I feel good because I know everything is okay. I said when I don't see you, I have to find you on phone, on call, on everything. Yes, but I know you are doing good. May God be blessed. Now, threatened miscarriage. I'm not going to use the other word. I've explained why. Stan's Kitchen is here. Stan's Kitchen, thank you so much for being in the platform. We are talking about issues concerning early bleeding in pregnancy. Early bleeding in pregnancy. And when I say early bleeding in pregnancy, I'm saying below 20 weeks. That is the first trimester of 3 months plus 2 weeks or 1 month. That is early bleeding. And specifically, today we are dealing with things that are called miscarriages. Greetings, Dr. Benjamin. Happy New Week to everyone in the chat. Let's say Happy New Week to everyone. Stan's Kitchen, thank you so much for telling us that. I will have you on my TV busy. No worries, Share Travels, no worries. Share Travels, I thank you for that. Support. And everyone, I will beg you to support Share Travels. I want her to get hours. I want Stan's Kitchens to get hours. I want your Jamaican Uncle to rise on subscribers. So everyone who will watch, if you will watch later or you are watching right now, please check it out them. Check their channels. If you have not subscribed, subscribe, and don't just watch. Leave a like and a message. Compliments works. You know, compliments give someone morale. So the category that we are here with, we talked about several ectopic pregnancies, part of early bleeding in pregnancy. Now we are talking about early threatened miscarriage, but is under several types of miscarriage. And I've said, I will not say abortion. I will say miscarriage, because that word is flagged. If you use it several times, it will bring problems to this video. Now, threatened miscarriage is a vaginal bleeding during and before 20 weeks of gestation with a closed cervical os and a viable intrauterine pregnancy. I've said threatened means if you don't take care, something bad will happen. So this means that with a viable fetus that is growing good, but you are bleeding. You see? Yeah? But you know it is below 20 weeks. It's below 20 weeks. Yeah? So let's say 20 to 25% of pregnancies during the first trimester, they undergo this, so some bleeding. But if you take care, you are well. You see, about 50% of women get it, continue to have pregnancy normal, and they give birth. So threatened miscarriage is something that can be managed, and then you get better, and some may progress to miscarriage complete. But if you handle threatened miscarriage in a good way, you will get your baby at 9 months. So what are the causes and the risk factors of threatened miscarriage? What are the risk factors? One is age, advanced in age. People that are 35 years of age and above, they have the risk of having this. When you have conceived and the birth is going on well, progressing on well, and you're going up to 20 weeks, you may start bleeding because of the hormone imbalance. Maybe sometimes, you know, the hormone that takes care of pregnancy is called, progesterone. And corpus luteum is the one which takes care of bringing progesterone. So if you are bleeding in pregnancy, Just check your progesterone levels. Maybe previous miscarriage, maybe you have trauma, you can fall down, have an accident, and you may start bleeding. People that smoke, smoking has a problem everywhere. Smoking has a problem everywhere. Alcohol consumption brings problem with clotting factors, even smoking. You remember smoking is the first brother to the mother to producing free radicals to your body. So when you smoke, you are making the clotting factors not to work well. So let's stop smoking. Let's stop smoking, my friends. Let's stop smoking when you are pregnant. And not even when you are pregnant. It's harmful to your life. Even illicit drugs like coke, cocaine, alcohol. If you like alcohol, take it minimally. But I don't say you take alcohol. Reduce it. There are some people who have thyroid disorders, obesity, severe stress. Someone has severe stress. Those are the things that we should look at and say, no, these are the risk factors. So you stop it, because if you have threatened miscarriage can end up causing problems. See you soon. No problem, Stan's Kitchen. Thanks for tuning in and leaving me your like. Thanks so much, Stan's Kitchen. Everyone who is watching, thanks for coming in. If you're Dr. Ben, you're tuning in to Benjamin the Wise Guy channel. We discuss issues concerning health issues, and this week we are discussing issues concerning bleeding in pregnancy. Bleeding in pregnancy. So if you are new, you have any question that is not even bleeding in pregnancy, you can come to the chat, tell us which country you are watching from, which state, and then we relate, we interact with the people at the chat, and then we grow further. But don't leave without giving subscribe to the channel. It's a good channel. You can check out what we do in the channel. You can check out what we do in the channel. Now, let's talk about something that is called fetal factors. You can bleed because the fetus has a problem. You can bleed because the fetus has a problem. Chromosomal abnormalities is also another thing. Most common cause, congenital malformation. The baby is growing with abnormally. Some factors, the placenta is not yet well. It is detaching from it's not forming the way it should be forming. Those are the issues that make you to bleed. Uterine factors. We have normal factors, the risk factors, we have fetal factors, we have the uterus itself. It can make you to bleed. Like women that have fibroids, there is something called septa uterus. There is cervical polyps. Those are muscles, things that grow in your uterus. They are called myomas that grow in your uterus. These are problems that can make you to bleed. Septa uterus is another condition that people always we say congenital abnormalities. Congenital, you are born with, you cannot avoid, like things like uterine fibroids. Sometimes you can have a baby while bleeding because the fibroids themselves are the ones which are bleeding. You see, the fibroids are the ones which are bleeding. And then we have infectious causes, infections. You don't take care of yourself, well, and then you start having infections. Bacterial vaginosis, sexually transmitted disease. While you are pregnant, you get sexually transmitted disease. It can end up to your uterus and then you start bleeding. And infection plus bleeding, they are brothers and sisters. So we have to take great care about that. So threatened abortion, you have said, 50% of women give birth well, and most 25% to 70% of current women, they undergo this. So factors, fetal factors, uterine factors, hormonal factors, infectious causes like UTI, bacterial vaginosis, and sexually transmitted infections may be the cause. And how does it come? You see, how does it come? That is another. If you have any question about this miscarriages, You just ask. Don't fear. Just ask. Hello, Dr. Benjamin and team working and watching. Bless up to burnout to be blessed. Big up all the time where you're chilling from. May you be blessed always. Now, the pregnancy is still implanted within the uterus. This is how it comes. The pregnancy is implanted within the uterus. But there is partial separation of the chorionic membrane from the uterus wall, leading to bleeding. You get that from the chorionic membrane, it detaches a bit. So, it's like a wound, because when they are detached, you can't bleed. But when they are detached, you will start. The uterus and the placenta membranes, they are detached like this. So when they abruptly come out, you will start bleeding. You see? This sequence is, implantation occurs normally. Small blood vessels rupture. Blood accumulates behind the placenta. Now, this is the placenta. This is the uterine fundus, though the placenta is here. So detachment is like this. So, you see, you start having bleeding inside the uterus as it's coming out. But the cervix remains closed. Fetal heartbeat is present because the vessels that take blood to the fetus inside your fetus, they are intact. So it doesn't suffer. Pregnancy may either continue normally or progress to miscarriage. If the detachment is bigger, it may end up to be a miscarriage. But if the detachment is not big, it's just a small detachment, it may end up to, and that's why we give bed rest to women like these ones. We give bed rest to the women like these ones. We tell them rest, because the more you move outside, the more you are helping the placenta and the uterine to detach, and the bleeding continues to be more and more, and then it will come to be something that is called placental abruptio. We'll talk about it. Now, features are like vaginal bleeding. Sometimes you get spotting, light bleeding, occasional moderate bleeding, but the cervix is closed. Minimal. If you touch if you touch the abdomen, you may find some tension, and you may feel some tenderness, minimal tenderness, because there is pain of the detachment of the uterus and the placenta. It's a wound. It's just a wound. No passage of fetal tissues. Fetus heartbeat is present. We are dealing with the first trimester and 1 month. That one, the fetus has already been formed. So, threatened miscarriage is one of the problems that we encounter with our mothers who are at antenatal clinic. So, this one must be taken very careful, because the more you take it careful and you take good care of this mother will give birth so nice and well. So we will talk about another. Today we are going through faster and faster. We want to deal with this miscarriage. If you have a question, don't fail to ask. Don't fail to ask if you have a question. If I'm going faster, you don't fail to ask. So source of bleeding, you should check. You do a speculum, you check if the cervix is closed or opened, because if the cervix is opened, it means a bigger problem. But if the cervix is closed, it means you are okay. You see, Betty C 1876, thank you so much, Betty, for tuning in. No retained products, you check out binocular examination by manual, uterine size, cervical os closed, adnexal mass, to check if adnexal mass, you check if there is ectopic pregnancy. That one you must rule out. So there are some things that we do, like full hemogram, serum, HCG levels, progesterone levels, because progesterone is the one which takes care of the pregnancy is being released by corpus luteum. Check for urinalysis. Is this woman having an infection? Check them all. Do an ultrasound to check where the thing is coming from. So that you may know how to treat the woman. Now, let's talk about another one. That one was called threatened miscarriage. Threatened miscarriage. There is another one that is called inevitable. And I've said I'm not going to name the other name that you know, because it may bring problems. The other name is abortion. Eh? This one, I will call it here. I will call it miscarriage. Miscarriage is a better name than the other one. Now, what is inevitable? Inevitable miscarriage. Let's talk about inevitable. What do you understand by the word inevitable? Inevitable word means you cannot avoid. It is done, you know. It is, you cannot avoid, it's done. Inevitable miscarriage is irreversible loss of uterine pregnancy below 20 weeks of gestation. Below 20 weeks of gestation, characterized by vaginal bleeding, abdominal pain, and dilation of the cervix. You know, when the cervix, don't know if I can draw. Let me draw these things. How are you saying, my friend? We need to understand these things. How, you know, we need to understand. What do you say? We need to understand. So let me draw two cervix, you see. Two uterus. Two, you know, a uterus is a flower. A flower that gives us good things like a child. A flower that gives us two things. A child, it gives us very many things like that. You see? So, I'll draw two uterus. If you have a question what we are doing, ask. You may come to the channel, we are moved, you don't know what you are talking about, and you are silent. You know, it's good to say, I don't understand what is going on. What are you guys talking about? And then we explain to you, and then you'll be part of us, and then you feel good. If you are coming in right now, this channel is for Benjamin, the wise guy is the host. Dr. Benjamin is the host, and we try and sensitize and know how life is. Look at these two pictures. Look. Yes, Dorothy, long time. I've been here and there. No worries. These two pictures signify two things. They signify an open cervix and a closed cervix. This closed cervix, hello doctor, hi. This one is closed. The fetus is okay, it's growing, but this one is open. The cervix is open. You know, after the cervix, you go to the vaginal tract. So this is you. So you check it out. So this one, when it is open, you cannot save the fetus. But when it is closed, the fetus is still there. You can save the fetus. Now, this inevitable miscarriage below 20 weeks of gestation, that's 3 months plus like 1 month. Check this. If the fetus has been destroyed, the bleeding has continued, it is called inevitable because you cannot help. You cannot help anything. Everything is gone. Now you have to remove the remaining so that the mother can heal, and then you wait for another pregnancy. One of the most common type of potential abortion most occurs during first trimesters. The overall risk of miscarriage is 10 to 20%. You know, Betty, hi Dorothy, welcome. If you are new to the channel, tell us how you are new. Hit the like button, subscribe, and come to the chat. Tell us where you're watching from. Now, common cause and risk factors. Fetal causes. What can a fetus entail? You have a fetus and it is making you to have a miscarriage. There are some things like chromosome abnormalities. I said about these things earlier. We talked about them, and if you want me to repeat one day about chromosomes, we will repeat. Aneuploid. You know, some things that, you know, when a fetus is growing, it has chromosomes that should match. But there are some chromosomes that don't match. Aneuploid means is a genetic condition whereby a cell has abnormal number of chromosomes, either due missing or extra ones, and they may bring someone to have a miscarriage. Mostly when they are less, they are less. Trisomy is another complication of chromosome. Trisomy. You see how these miscarriages come. These are the things that when you are with the baby, and then they undergo trisomy, they have chromosome issues, you may have a miscarriage. A genetic condition characterized by presence of copy of chromosomes resulting in 3 copies instead of usually 2. It is called 3 copies, trisomy, 3 copies. Monosomy, Turner syndrome, monosomy. Monosomy is when you have 1, monosomy X. Come on, monosomy. Now, in fetus, when you have a fetus that have these complications, the risk of having a miscarriage at the early age is high. The risk is high. So these are things that you cannot do anything. They are genetic. Sometimes you can find something that is called monosomy X. It's caused by female, caused by complete or partial absence of X chromosomes. I think I have to do this topic and then I give people to go through it so that you can know. Diploidy, polyploidy, those are chromosome issues of the fetus. Maternal causes. And how about a mother himself? You are a mother. What things do you have that can make you to have miscarriage? Now we have come from the baby inside you under 20 weeks and it's growing. Now let's talk about us, bigger people, mother himself, a mother. Advanced in age, mostly above 38, 35. If you have had previous miscarriage, it can entail you. There is something that is called cervical incontinence, and placenta, and placental issues. Poor controlled diabetes mellitus. Thyroid disorders can cause a miscarriage. Autoimmune disease like antiphospholipid syndrome, severe anemia, and chronic hypertension. Chronic hypertension can have someone have a miscarriage. And you saw hypertension can go up to preeclampsia. We talked about preeclampsia, hypertensive disease in pregnancy. And you saw eclampsia is high BP over 140 over 90 with protein in urine, but you are pending to get Caesars. Hello, Dr. Benjamin and everyone. Marche, welcome. Hello. You see, you are just about to get Caesars. So, and if you get Caesars, you may get a miscarriage. You see? So these are the things that we should do as mothers, not to get this thing called hypertensive crisis or the bleeding in pregnancy and mainly inevitable miscarriage. Inevitable you cannot avoid, you have to do away with everything. Now, those are things maternally. We have started with fetus complication and genetic issues are the causes. Maternal causes, previous miscarriages, poor controlled diabetes, thyroid disorders, severe anemia can cause a miscarriage, chronic hypertension can cause inevitable miscarriage, and advanced and maternal age. Uterine causes. What are the uterine causes? The causes in the uterus. Congenital uterine abnormalities, uterine fibroids can cause, uterine adhesions. Some uterus has things that are adhesive, they are growing inside the uterus, can cause. Cervical causes, your cervix, cervical insufficiency. The cervix cannot hold a baby. As the baby is growing, it opens. You see, as the baby grows, it opens. It's called cervical incontinence. You see, these are things that can cause you to have this inevitable in miscarriage, previous cervical surgery, infections like malaria, syphilis, listeriosis, rubella virus, toxoplasmosis, you see, cytomegalovirus. You see, those are things that we should check. They can make a person to have inevitable abortion, and inevitable abortion, miscarriage, you cannot hold it. Lifestyle factors, as ourselves, we can make ourselves to have problems. We can make ourselves by what we are doing to have problems like smoking, alcohol, cocaine, and illicit goods, excessive caffeine intake, and radiation exposure. Traumas. Traumas can make you have these problems. The traumas can make you have these problems. What kind of traumas? Accidents, you see, severe abdominal trauma, fights. You are pregnant and you are involving yourself in fights. It's not good. So, in inevitable abortion, miscarriage, I don't want to call that name. It keeps on coming. Fetal death or severe fetal abnormalities occur because you are bleeding a lot. Placenta separation begins and the bleeding develops between placenta and the uterine wall. Prostaglandins are released, and when prostaglandins, they are mediators of prostaglandins are mediators of doing what? Inflammation. So you start feeling pain. Uterine contractions. When prostaglandins are released, uterus starts to contract, and contraction increase, expulsion occurs. The cervix softens and it opens. It dilates and it opens. Anything that happens to the uterus and contraction starts, it means it is pushing those things out. So the products of conception descend to the cervical canal. Pregnancy cannot continue, leading to miscarriage. And this one is accompanied by heavy bleeding, pain, because prostaglandin is equals to pain. At the lower abdomen, severe colic pain, passage of blood, and pelvic pressure. Lower back, you will feel it. Signs are cervix. If you check the cervix, it's open and dilated. The products of conception, you can see them, they are coming out. So when you go to hospital, you have tachycardia, the heart is beating so fast for compensation. The blood pressure is low because you are losing blood, and paleness, you start being pale and dizzy. When you lose blood, you are dizzy. Now, that is about something that is called inevitable. This one, you cannot do anything. Inevitable miscarriage, that one you just do something that is called MVA or cervical curettage to clear whatever that is remained, so that the mother can go home and wait for another baby. Incomplete miscarriage. Incomplete. What is incomplete? This one is just like inevitable, but you know the problem here. Some parts of whatever that was coming out is still inside there. You see, it is just like inevitable. Nothing. The products of conception below 20 weeks are still there, and you will see the causes are still the same. Maternal causes, advance in age, previous miscarriage, poor control diabetes, thyroid disorders, autoimmune diseases, and severe maternal illnesses. There are some women, when they are pregnant, they are so ill, malaria. They are undergoing congenital anemia because of maybe they have something that is called kidney problems. You see these things, very important when we talk about them. Uterine causes, congenital abnormalities, fibroids, uterine adhesions, they are just the same. It's only the if you go to cervical causes, cervical insufficiency, the cervix cannot hold the baby. It opens as the baby grows. Previous cervical surgeries can enhance this, and infections, malaria, syphilis, listeriosis, toxoplasmosis, rubella, and virus. Talk about lifestyle factors. Lifestyle factors like smoking, alcohol use, other drugs like cocaine, excessive caffeine intake and exposure, or to radiations, where you are pregnant and you are exposed to companies that are using radiations, UV rays, and some chemicals and some heavy metals like lead. You may end up having incomplete. The only difference inevitable and incomplete is the product of conception. As they come out, something they are remained inside, and you see that is very bad. That one is bad because the problem is, if you continue having the product of conception inside, we call them in situ, you will bleed a lot. I'm supporting Dr. Benjamin, Dr. Benjamin, from the background. Thank you so much. As you listen, I know you can help one mother one day. If you get to see that this mother is undergoing a treatment, you save the life so quickly, you see, of the mother and the baby. So these are the facts that we talk about when we talk about the miscarriages, incomplete. So when the incomplete abortion has occurred, what do? You do an ultrasound to confirm it is incomplete. You will see inside, if you do an abdominal ultrasound and pelvic ultrasound, you will see some products of conception left inside. So you check out the differential diagnosis and you have your diagnosis. It is incomplete. So you have to do surgical management, manual vacuum aspiration. You remove the products of conception, or something that is called dilation and evacuation. Later, gestation where appropriate. You see? So when you do these things, you may do an anti-D immunoglobulin. I mean, the drug that we give you, anti-D, after miscarriage, so that maybe the miscarriage occurred because the baby's blood and the mother's blood were having problems and interacting. I have to talk about anti-D immunoglobulin so that people understand what I'm talking about. I'll have that video tomorrow so that you understand. So let's talk about another thing that was incomplete. The only way to manage is to go back inside and remove the products of conception so that bleeding cannot continue, and give you some antibiotics so that you cannot get infection and stop the bleeding. If some of the products of conception when the baby was growing comes out and others are left, the bleeding will continue and you'll have a big problem. Anemia, complications will rise up, Now, there is this one that is called complete miscarriage. The same risk factors, the same problems as we said are here. So here, entire pregnancy is expelled outside. Bleeding decreases and cervix close. The cervix close here. The cervix after the bleeding has finished, the cervix come back close. And when it closes, what happens? You continue with life as normal. Pregnancy symptoms disappear, the cervix close. That one means everything went out. You are just given medication and bed rest, and you are given medication and bed rest to rest, and everything turns out to be normal. So when I talk about something that is called septic abortion, septic miscarriage, I keep on saying I will not say that word and it comes out. Septic miscarriage, infections of retained product, fever, because if you have an infection, what happens? You start having fever. The pelvic, because your uterus is around your pelvic, what happens? You start having pelvic pain. Septic miscarriage is a very bad one because it becomes and it goes systemic. It goes systemic, and when it goes systemic, what happens? Problems. Below the 20 weeks of you carrying a baby, if you start feeling fever and bleeding, and sometimes headaches, it may lead to something that you cannot stop bleeding, because infections are bad. The bacteria come with things that change the what? They come with things that change the clotting factors. You see, this one is not very common, because I know women, when they are pregnant, they really take good care of themselves. There are some things that are called unsafe induced abortion. You use instruments. People use instruments because you think you are not ready for the baby. And then some things like retained placental fetal tissue provide a medium for bacterial growth. This one is incomplete abortion or incomplete miscarriage. Untrained providers. And that's why I don't like when mothers go to hospital. You start doing digits to confirm every time. Your hand is dirty. You put on a glove that is not sterile. You continue doing digital examination, and that mother, you are inducing infections. Insertion of foreign objects into the uterus. Foreign objects in the uterus. It's not good. Incomplete miscarriage, ascending genital tract infections. When you have made love, you have had sex with someone who is not clean, maybe this person has a UTI, you start having the problem. The infection starts to rise. Failure to evacuate retained product increase the risk of infection, because if someone had incomplete abortion and the work that was done was not good, the work that was done was the manual vacuum aspiration or cervical curettage was not done well. It leaves products of conception, and you remain there with a medium for bacterial growth. When you have a medium of bacterial growth, what happens? You start having problems. Ascending genital tract infection. Ascending genital tract infection. Bacteria ascend from the vagina and cervical into the uterus. So when you have pregnancy, it's very important to take care of your sanitation and health. Sanitation and health are very important, because you see, some bacteria may bring a problem to your life as a woman, and it may be bad and bigger than what you expected. Bacteria like Staphylococcus aureus, Streptococcus, a species, they are things that you live around with, but they can bring a lot of problems. Anaerobic, like a bacterioides species in the stomach and the gut, Streptococcus species, Clostridium species, those ones. Let's talk about things that can make you to have these problems. These problems may be brought by us ourselves. Unsafe abortions. Retained products of conception, because you went to a person who doesn't understand what he's doing. I've seen some people going over the counters. You go over the counter, you buy some medicine, and when you buy the same medicine, you think you are safe. You start bleeding at home. This one goes to the young chaps, young girls and boys, that they are not ready to be fathers, but to do, and they don't know who to go to, so they go to anyone, as much as the pregnancy can go. It is unsafe. It can lead you as a mother or as a child to lose your life. And there are some people that are promiscuous. You find that some women are not. The pregnancy is not for the husband. So you find that it can bring problems to the family, and you end up to go to seek for in hiding. You go in hiding. because you don't know, you don't want your husband to know what you did. So you end up bleeding. And when all it comes to us, of course, this person has to know why you are admitted, and then you kind of like hide with the doctors, saying, because some people say that it will break a family. These are things that happen, and they happen outside here. The promiscuity and not knowing that it can have a problem. Delayed treatment of miscarriage. I've seen some ladies, when they have miscarriage, they don't go to hospital. You cannot, it's not a must to induce. It is not a must to induce. It can come out because of hormonal problems, the problems that we have said, genetic problems, fetal problems, environmental factors. So you stay with it, and you stay with it with the fetus that has died for so long. You end up having a problem for yourself. And then you go to hospital mostly the teaching and referral hospitals. You meet students, they want to practice with you. So the people who are facilitators should be very careful to the mothers that come to these teaching and referral hospitals. Why? Because if you let all these trainees to train to one mother every time you are doing digital examination, giving infections, and you are in internship and trained, you don't know what to do, you are training. Multiple examination can give you infections. And I've said another thing is promiscuity can end up a woman to have sexually transmitted infection. And then you give your husband infection, then it turns out to be he's the one who is bringing. You see, there are some things like poor economic conditions. Poor economic conditions can end up someone not to have good sanitation, no good food, no drugs. Economic conditions, sometimes they are unavoidable, but you see, it is very important to note these things down. Help these mothers that you see they are struggling when they are pregnant. Diabetes mellitus. Diabetes has been a cause for many miscarriages. So when you are diabetic and you know you have a baby you are bringing to the world, please be close to a doctor. Go start your clinics early. Very important. Go start your clinics early. Because when you start your clinics early, what happens? The doctors know how to help you to make good decisions and to have the baby in the right way. You see, very important. It's a very important thing to start seeing a doctor when you are pregnant. Very important. If you see a mother is pregnant and is not going to antenatal clinic, please talk to this mother. So retained product of infection become infected. Bacteria invade the endometrium. Infections spread to the myometria, to the muscles and the inside of the muscle, which is called endometria. Bacteria and the toxins they produce enter the bloodstream. A systemic inflammatory response comes. You start shivering. You start having fever. Sepsis progress to septic shock if untreated. You can find yourself in hospital without knowing yourself. And if bleeding is there, you will have something that is called disseminated intravascular coagulation and multiple organ failure. Very important. In septic abortion, septic means infection. Septic means infection. So even the incomplete abortion, you will find sepsis. It can be incomplete septic, but it can be incomplete non-septic. So it's all those that we have named: inevitable, threatened, incomplete, threatened. There is something that is called a blighted ovum. I'll not discuss that now. I'll discuss it when I'm discussing something that is called hydatid mole pregnancy. That I said, you have a pregnancy, when you go and check for pregnancy test, it becomes positive. But when you check for a full an ultrasound, there is no thing, there is nothing. You don't have a pregnancy. Where does that positive pregnancy comes from? Now let's talk a bigger thing here about infection. All those that we have named for miscarriage, all those things that we have named about miscarriage, they can end up to be septic. They can end up to be an infection. So what are the signs of infection? What are the signs that this person has a miscarriage? Yes, but it is infectious, septic. You will have fever, and you have seen how it starts. Let me repeat. Retained product of infection becomes infected, retained product of conception become infected. Bacteria invade the endometrium. Endometrium is the layers of the uterus, the layers, the inside layer, the endometrium. And then bacteria and toxins, they enter the bloodstream. The bacteria and toxins, they enter the bloodstream. When they enter the bloodstream, what happens? Systemic inflammatory response, because if bacteria goes to the bloodstream, your body will not stay like that. It will start fighting the bacteria. So if they start fighting the bacteria and the toxins and everything, they bang out. You start having fevers. And if this continues and the infection is not treated, sepsis progresses to septic shock if untreated. You may end up in hospital without knowing you. And you know you are bleeding. And toxins that bacteria bring, they can end up, if you don't know, those toxins that bacteria bring, these toxins, they make a coagulation factor, the clotting factor not to work well. So you may end up having disseminated intravascular coagulation. Disseminated intravascular coagulation means you are not stopping to bleed. There is multiple organ failure occurring. The bleeding is just continuing. It is called DIC. If you go to a hospital and you hear a doctor saying that this person unfortunately has entered to DIC, disseminated intravascular coagulation, know that it has become a complication that they cannot stop. Why? Because it is very bad. Surviving the series is here, always shouting my name, Benja. Surviving the main series. So you see how it happens. So you guys, let's check about these things, important factors that can lead to this. But let's talk about the clinical features of septic. What makes you know that this one no, this one is septic? Fever is the first. As the inflammation is going, surviving the series, welcome to the platform. We are talking about our women. Fever, chills and rigors, low abdominal pain, pelvic pain, foul-smelling vaginal discharge. Discharge down there is coming and you smell, you feel, wow, this smell I cannot tolerate. Man, heavy or persistent vaginal bleeding, malaise and weakness. Because when you have weakness, you are bleeding, you will be weak. Nausea and vomiting because of the systemic inflammatory response. Now, general signs can be temperature over 38, temperatures become so high because the inflammation around your body is coming up and down, fighting up and down. You have the heartbeat that is pounding, and your blood pressure is going down. When you are bleeding a lot, the blood pressure goes down. Hello from Florida, dear. Shalina Hartfield, welcome Charlene Hartfield from Florida. We are talking about early bleeding in pregnancy and types of miscarriages. Welcome Charlene Hartfield. Big up, hit the like, tap your phone, let me get your like, and subscribe if you haven't subscribed. Hello from Florida, dear. I'm fine. Charlene, hope you have subscribed, yes? Thank you so much for tuning in. You see, now fever, chills, lower abdominal pain, pelvic pain, foaming discharge. Thank you, Charlene. My friend, you can go to a hospital. You pass through a bed of a woman has had this septic miscarriage. You will not like it. Weakness, nausea, and vomiting. Temperature is high. The heart is beating so fast. Tachycardia. Welcome. Thanks, Charlene. Thanks. Do you have a channel, Charlene? If you have a channel, tell us. Pala, confusion is late sign. Abdominal examination here is always important. Pelvic examination. If it is incomplete, septic, antibiotics and evacuation. If it is inevitable, septic, that one you just check if they are products of inside conception. We remove them and we keep you on strong antibiotics. Septic shock. What will make you know this woman? What will make you know that this woman has come to the hospital, but now this miscarriage is severe? A woman comes with shock, not understanding herself. The woman is not understanding herself and is confused. Altered mental status. You are talking to this woman and cannot answer you directly. The woman is confused. Low urine output showing you this lady has low blood pressure. If you check the hands, they are bluish in color. They are bluish in Charlene, thank you. Hi, Mr. Benjamin. Fiona, how are you doing from Uganda? Hope you are doing good. Thank you for tuning in. I'm talking about matters concerning ladies. Matters concerning ladies. Multiple organ dysfunction. If your urine is low, you have hypertension. Your kidneys will suffer. Your kidneys will do what? Your kidneys will suffer. And this is how we know that there is a problem here. This one is, sometimes we usually take them straight to ICU. If you are out, you don't know yourself. Before we start doing anything, we stabilize you first. It is important, the things that we do for every miscarriage, we do them correctly. Now, for young ladies, it is important. Let me talk about induced miscarriage. And this is what I'm talking about when it comes to mental health. Let me share this. Charlene from Florida. How is Florida, Charlene? How is Florida? How are things getting there? Next year I'm starting to walk around. I've not traveled for so long. So when I start traveling, hope Florida, I'll pass there and say hi to my people and know places. It's good when you have worked so much for so long. At least you have time to meet and travel out. We are in rain. At least the heats are going down. That's good. We thank God. Anyone with a question, my friends? If you have a question, it's the time to ask. And Charlene, I request you to share this. Oh, 95 today. There is still raining. It's raining and it's still high. No problem. No problem. It will be okay. But things at least are doing good. So, everyone who is watching, share these topics to women that are out there. Let them come to the channel and see what we do. You know, these topics that we talk about, they may help someone somewhere. They may help someone somewhere. And it's important it's very important to share. Tell your friends that Benjamin the Wise Guy has a channel that we help each other to maintain our health. Your weather, it is cold. A day ago it was so cold. But I did not get the temperatures. I had checked on one of my videos that I did a day ago, not yesterday, the other day. You will see I was in a resort somewhere and it was so cold. Here it's in Kenya, Africa, but today at least I can see outside there is a good weather. There was sunshine and we enjoyed it. And it's 6:37. We are heading to 7 right now, and it is not so much cold. But today is okay. Now, induced miscarriage, more commonly caused, I don't want to say that name that people use, is intentional termination of pregnancy before fetus. Your country is beautiful. Yes, Charlene, you should come this side one day and walk around. Check the video that I did a day ago. You'll see how that place is nice. But I want to go out there. I want to visit places next year. I see how the other part of the world are looking for. Emotional reactions vary widely. When you have decided that I want to terminate this out of fear that you cannot have a baby. You know what? I would love to, but I don't know anyone. Talk to Jamaican uncle, talk to Sha Travels. There are so many people from around where you are that come to my area. You can email me and we can talk. My email address is where might I be? My email address is yahoo.com. You can email there, or you can do what? You can WhatsApp me. Most of the people here have got a number that they WhatsApp me with. You can WhatsApp me with. I can give you links. We can interact. And one day when I visit Florida, you can say you are not leaving me behind. Let me go and see Africa. Yes. Now, common emotional response when you have done it, induced. It comes with relief, sadness, grief, guilty, regret, anxiety, and anger. Why did I do this? Guilty conscience rises. Emotional numbness, hopeful about the future. You see? You see, these are things that before induced, but you see, there are some other countries that say, people are saying that it should be legal. What do you think? That is something that I want to ask people. What do you think? It's something that is a topic that has been so, let me put it as a poll. It's a topic that so many have gathered about, and everyone is fighting. Christians, they ask. Let me put it as a poll. Should induced miscarriage? What do you think about that? If you can have an answer well and good. Should induced miscarriage be legalized? Sometimes you can have induced miscarriages, and then they give you all these psychological problems, they give you this trauma mentally, you see. Individual factors that may happen after induced miscarriages: previous history of depression and anxiety, previous mental illness, personality and coping skills may be there, age and emotional maturity may be a problem. Age and emotional maturity may be a problem. You see, we already have one poll saying yes. Pregnancy related factors. Pregnancy related factors. Whether the pregnancy was planned or unplanned, you know. Gestational age. Is it above 20 weeks? Is it below 20 weeks? Why are you doing it above 20 weeks? Why are you doing it below? Because above 20 weeks, that's a baby that will come out. Not on term, but below term. Will you handle it as a mother? Presence of fetal abnormalities, maternal health factor problems. Women after miscarriages undergo several things. So you may induce thinking you'll be okay when you need it, and you start having miscarriages because of the first inducement. Social support, family support, partner support, financial situation, community attitudes, social stigmas, access to counseling. You see all things that come out when you do these things. It is a multisectoral thing that come out. And then you yourself, you buy yourself into mental illnesses, which are excessive worry, restlessness, difficulty in sleeping, panic attacks. You have seen some people after doing something, they end up having panic attacks. You start panicking every time. You think that everyone knew what you did. Panic attacks. You get it? It is very important when you decide to do something, you take time and rethink. And you've seen it has been a matter of very many communities worldwide. Some are saying we should legalize, and others are saying we should not legalize. This is not the right way to go. And even the poll there put it in asking the same thing. And you see everyone has got his or other opinions that may support what that person is saying. So I'm not saying it is good, I'm not saying it's bad, but the opinion that you have, the opinion that you have supporting what you are doing should be a backing to what you are doing. Are you doing the right thing? You see, mental health is a very important factor in someone's life. Mental health. And after you have done something, thanks for having me. I'll capture it later. It's okay, Charlene. I just have like 10 minutes before I drop. So you link up with me. We will know what to do. But keep on coming and supporting the platform and share the videos too. Have a nice day, Charlene. You see, so mental health is very important, and we should also think before we do. I think we should think before we do some things. We should think before we do some things. Here, let me check before we finish. That was the last topic of induced miscarriage. Panic attacks, difficulty sleeping, restlessness, excessive worry, depression, persistent sadness. Oh, you too have a great day. Thanks, Charlene from Florida. loss of interest in activities, feeling of hopelessness, suicidal thoughts, why did I do it? And then you start grieving. Which is not a good thing. You have seen people going towards post-traumatic stress symptoms. Because when you induce with a quack, a person who doesn't know what he is doing, you may end up having PTSD because it becomes painful, and what you undergo is so, it becomes, because this person was not a professional, it becomes traumatic. And you will see people starting to have flashbacks, nightmares, avoidance behavior, hypervigilance, things like those ones. Avoidance behaviors, hypervigilance, you see, those are things that we don't want to see on our generation. So what do you think? Should we legalize this thing, or should we just leave it to continue? What do you think, my friends? Very important to note this. Substance misuse, protective factors like we should have a strong family, access to accurate information, voluntarily informed decision making, good counseling before you do it, prompt treatment and complication, access to mental health services when needed. And mental health assessment is important. Counseling, psychological support, treatment of mental illnesses, follow-up, checking on recovery. Don't just say that one is a very bad person, she did this and she aborted. Follow up as a family. Check the recovery process. Have a contraceptive up to when this person will want to have kids. And future planning. Teach these people on future planning of pregnancies. Very important. Very important. And there is a way you can prevent psychological distress, because after induced issues, you can have psychological stress. After you have induced issues, you start having even coping with other people becomes a problem. So what do we do when you are at this place? What you do is, there is comprehensive pre-abortion care, where your counselor talks to you about how to move on, about to forget what you undergone, all those. Informed consent, respect for privacy and confidentiality, how to manage pain, family or partner support, access to post-abortion counseling and follow-up is important. And sometimes when you are in hospital, there is nursing responsibilities. Assess emotional and physical status for the nurse. Provide compassion, which is non-judgmental. Monitor vital signs, and there is check signs of depression, anxiety, and acute distress. For all miscarriages, I'm not talking about induced only. Encourage follow-ups on appointment and refer for mental health services when indicated. If you see someone has mental health issues, you have to refer this person to a mental specialist. This is a lady that has carried a baby and has lost the baby. Maintain confidentiality and respect the patient's autonomy. Respect the patient's decision and the patient how she is. And it comes with complications. All these things come with complications like hemorrhage, infections, retained products of conceptions, uterine perforation, cervical injury, future reproductive complications, even infertility. even infertility. So you per se, you are the medical person that helps. You need to help this person. You need to help this person to transist from whatever that this person was undergoing to go to be a better person. Don't induce torture. Don't be rough on this person. Help this person to be better, even in family. Some parents are really tough when a lady is, Barry walking exercise. Blessings, Dr. Ben and everyone. Thumbs up, done. Welcome, Barry walking exercise. Thanks for tuning in. Nowadays, I'm late. I am late because you understand. I don't have specific time. My specific time for coming here is 4:30 p.m. Kenyan time, but I cannot guarantee it's 4:30 because I'm working. Now, hemorrhage, infections, all those are complications. And there is complications that are psychological, grief, depression, PTSD, relationship difficulties, and social stigma. Because now you did it and you went to hospital, you were carried, everyone was watching while you were being removed from your home, going to the hospital. It becomes a problem. When you are back home, it becomes traumatizing because everyone is looking at you like that one that lost. Let's take good care of our ladies and our women when they are in these conditions, that are trying times. You see, most people who have a safe legal abortion do not develop a safe legal one. They don't develop complications. You see. So guys, that one has been a talk on miscarriages, and it is very important when we are talking about miscarriages because all of our women undergo these things. It may not be induced, it may be because of those things that I've named. So when a person goes to hospital with a miscarriage and is a lady, you should be open to the doctor and tell the doctor what happened, so that this doctor knows how to start and how to help you. Instead of wasting a lot of time, if someone had induced, please just say, I induced them because of all this. The doctor will not be mad and rough at you. You see. So all that are here that have come to the platform, I think tomorrow we'll do another one. I'll do something that is called highlighted mode. I'll do something that is called highlighted mode. And after I do highlighted mode, I will check, because highlighted mode is when you have a pregnancy. You don't have a pregnancy, but it is testing positive. So everyone who has been here and has been watching, I can see today we had 17 likes. Thank you so much. And those that watch afterwards, be blessed. Share the stream, share the likes. Let's get to know everything that is going. Let me see. Today it has been 50-50. Yes are hitting at 50 and no are hitting at 50. So you see, it's a divided challenge. You cannot say, because this is thing that everyone has. I'll bring it as a topic one day. We discuss about these issues. Should abortion be legalized? I'll bring it as a topic one day so that we can see how we can end up. See. So my friends, everyone who has been watching, anyone with a question, if you are watching and you have a question, you can ask a question. Just ask a question. I give how many minutes? Let me give 6 minutes. And a person may have, or 5 minutes. Someone may have a question and it's hiding somewhere. and okay. So if you have a question, you can ask. It's important, but if you find that it is offline, you can just ask your question under the video here, and then we discuss everything as per how it comes. So it is here in Kenya. It's at 6:56, around 4 minutes to 7. Hope everyone is blessed and watching and feeling nice where you are chilling at. How are you feeling about the topic miscarriages? You have seen now, not everyone who goes to an hospital with an abortion has induced it. You see. So if you have a question, please ask. I have some 4 minutes to go. I'm answering some people that are asking here. You can ask any question that you have, or any insights. Insights also are okay. Insights are good, so that you don't just go and you have a question. You don't just go and you have a question. I'm trying to answer some questions offline here, so don't worry yourself. Don't worry yourself when we check this question. If there are questions that I can answer, I will do it. I will do it. So that has been the topic, and you see the topic is very important when we share ideas, and I don't overrule anyone's idea, or about this topic I don't overrule anyone's phone and anyone's idea, because you are a grown-up and you know why you said yes, we should do it, or no, we should not do it. So if a person says no, don't overrule. If a person says yes, don't overrule. Every answer for a grown-up has a meaning. So that is it, my friends. That is it. We have done several things. We have done this is early bleeding in pregnancy. We have done several things. Please check the other videos. You will check and understand what you are doing. You will understand what we are doing. If you are a new person to the chat, I always say leave a message. Don't just go. Leave a message to the platform and interact with the people that are here. You may find someone who is productive and potential to you, that may help you with something that you've yearned for so long. That you have yearned for so long. You see? So Mohammed, thanks for we are just about to leave, but thanks. Good afternoon, Mohammed. Good afternoon for you checking in. Good afternoon for checking in. We have been talking about miscarriages, and the last one was induced. So I see as you come in, you poll. Hope you have left your like. Don't leave without leaving a like. Hope you will rewatch. For those that double tap your screen and leave your like. Double tap your screen to leave a like. And those that have been here and have been watching since we started, thank you so much. My time is out, and don't fail to leave a like, and don't fail, share this to your WhatsApp, share these messages to your Facebook, share this message to every person you think it can help, so that we can grow. Now people know that every person who ends up in hospital, anyone who ends up in a hospital as a lady and has miscarriage, it's not that she has induced. There are factors that lead to a person to get a miscarriage. You get it, infections, all those that we have named. So you as keep on supporting my channel, keep on liking, keep on hitting double tap. There are some people who don't know how to like when you are using your phone. When you are using your phone, if you want to like a video, you will double tap your screen. You click on your screen, just on that screen twice, like tata, like that, it becomes a like. Someone asks me always, how can I like? I don't see that like button. You double tap your screen and then everything becomes well. So you guys, my time is up. Let's meet on the next topic. Be blessed and have a blessed evening. Have a blessed evening, my friends. Bye bye. Hope for those that are coming in, you will watch, and everything will be fine. Thanks for tuning in every time. May you be blessed. Bye.